In 1847, the maternity ward of Vienna's first obstetrical clinic had an 18% mortality rate. 1 in 5 women who walked through those doors to give birth did not walk out. They died in their beds, feverish, their abdomens rigid with infection, within days of delivering a healthy child. The doctors knew the numbers. They published them. And they kept walking from the autopsy room to the delivery room without washing their hands. One man figured out why. He proved it, with data, in one of the most controlled clinical observations of the 19th century. Death rates in his ward fell to 1%. The medical establishment responded by destroying him. His name was Ignaz Philipp Semmelweis. Most people have never heard it. The doctors who killed the women whose deaths he could have prevented, their names are in the textbooks. His took a century to get there. Semmelweis was born in Buda in 1818, the fifth child of a prosperous German-Hungarian grocer. He was educated in the classical tradition, sent first to Vienna for a degree in law, and somewhere in that city he pivoted, toward medicine, toward the wards of the Vienna General Hospital, toward a discipline that in the 1840s was still closer to philosophy than science. He earned his medical degree in 1844 and secured a coveted position as an assistant in the obstetrics department under Johann Klein. It was the most prestigious obstetrics clinic in the world. It was also, by a measurable margin, one of the most dangerous places in Europe to give birth. There were 2 maternity divisions at the Vienna General Hospital. The first clinic was staffed by medical students and physicians. The second clinic was staffed by midwives. Everyone in Vienna knew which one to avoid. Women admitted to the first clinic in 1846 died of childbed fever, puerperal fever, at a rate nearly 5 times higher than women in the second clinic. Pregnant women arriving at the hospital would beg on their knees to be sent to the second. Some gave birth in the street rather than risk the first clinic's doors. The doctors noted this with puzzlement. They had theories: bad air, anxiety, overcrowding, the shame of being examined by male students. None of these theories explain the numbers. None of them were tested. Semmelweis was 30 years old when the first piece of the answer fell into his hands, not in the clinic, but in a letter. His colleague and friend Jakob Kolečka, a professor of forensic medicine, had died in February 1847 after a student's scalpel nicked his finger during an autopsy. The wound became infected. Kolečka's autopsy revealed exactly the same pathological picture as the women dying of puerperal fever: the same lesions, the same inflammation, the same progression. Semmelweis read the report and felt the ground shift under him. The medical students performing deliveries in the first clinic came directly from the dissection room. They examined corpses. They cut into cadavers. They did not wash their hands before examining laboring women. The midwives in the second clinic performed no autopsies. They had no access to the dissection room. Their hands went nowhere near a corpse before touching a patient. Semmelweis called it cadaverous particles. He did not have the vocabulary of germ theory. Louis Pasteur would not publish his foundational work for another decade, but he understood the mechanism precisely enough. Something was being transferred from the dead to the living, something on the doctor's hands, something that killed. He mandated chlorinated lime hand-washing in his ward in May 1847. Not soap and water. He chose chlorinated lime specifically because he had observed that it was the only thing that eliminated the smell of cadavers from his hands. The logic was empirical and exact. If the smell could be washed away, perhaps the killing agent could too. The mortality rate in his ward fell from 18.3% in April to 1.9% in June. In July, it fell to 1.2%. The numbers were not ambiguous. They were not a coincidence. He tracked them month by month, patient by patient, in meticulous tables. Across 1848, his ward recorded a mortality rate lower than the midwife-staffed second clinic. The evidence was as close to conclusive as mid-19th century medicine could produce. He presented his findings to his colleagues. He expected, if not celebration, at least engagement with the data. What he received was ridicule. The rejection was not uniform. There were individual physicians who took him seriously, but the institutional response was hostile and, in some cases, contemptuous. The reasons were multiple and they were telling. To accept Semmelweis's conclusion was to accept that physicians, educated, respected, socially elevated men were personally responsible for the deaths of their patients. The hands that touched the dying women were the hands of doctors. There was no comfortable distance. No miasma in the air to blame. The agent of death had a face, and it wore a medical coat. Johann Klein, Semmelweis's own department head, refused to implement hand-washing across the clinic. He did not engage with the data. He did not produce a counterargument. He simply declined to act, declined to renew Semmelweis's position, and effectively forced him out of Vienna in 1850. The reasons Klein gave were procedural. The reason evident in the sequence of events was something else entirely. Semmelweis returned to Budapest, where he secured a position at the St. Rochus Hospital's obstetrics ward. He implemented hand-washing protocols immediately. Mortality rates dropped to near zero. He had now demonstrated the same result in 2 different hospitals, in 2 different cities, across more than a decade of observation. He wrote a book, The Etiology, Concept, and Prophylaxis of Childbed Fever, published in 1861. It was 543 pages long, dense with data, and it was received with a silence that was almost total. The medical establishment's indifference in this period is not simply a story of ignorance. By 1861, the data was in front of anyone who chose to look at it. The rejection was active. Prominent physicians wrote public responses dismissing him. Carl Edvard Marius Levy, a Danish obstetrician, attacked the methodology. Charles Meigs of Philadelphia, one of the leading American obstetricians of the era, famously argued that doctors were gentlemen, and the hands of gentlemen could not be a source of disease. This was not a scientific argument. It was a class argument dressed in the language of medicine, and it worked. For years, it worked. There was also the problem of the mechanism. Semmelweis could not explain why cadaverous particles killed. Without germ theory, he was describing an effect without a cause at the molecular level, and the demand for a complete causal chain, a demand that was not applied with equal rigor to the competing theories he was displacing, was used to invalidate his entire framework. The bodies of evidence he offered were set against an epistemological standard he could not meet, a standard his critics did not apply to their own preferred explanations. Meanwhile, women kept dying. Every month that passed without implementation of hand-washing protocols, the mortality rates in clinics across Europe remained elevated. Semmelweis understood this with a precision that eventually became anguish. He began writing open letters to prominent obstetricians, letters that grew increasingly urgent and then increasingly accusatory. He called his opponents murderers. He was not using the word loosely. He meant it as a precise clinical description of the chain of causation. His critics called him unstable. In the summer of 1865, Ignaz Semmelweis, 14 years into a campaign of data collection, institutional refusal, and escalating desperation, had a breakdown. The exact nature of what happened to him is still debated by medical historians. He showed signs consistent with early-onset dementia or encephalitis. He may have been suffering from a neurological condition entirely separate from the stress of his professional circumstances. He may not. In July 1865, his colleagues had him committed to the Derbling Mental Asylum in Vienna. He did not consent to go. 2 weeks later, Ignaz Semmelweis was dead. He was 47 years old. The official cause of death was pyemia, blood poisoning. His autopsy showed wounds on his body consistent with a severe beating. The asylum had a documented record of physical abuse of patients. The man who had spent his adult life proving that doctors were inadvertently killing patients with infected hands died, in all likelihood, of an infected wound, possibly inflicted by guards, in a medical institution. The irony is precise enough to feel constructed. It was not. It was simply what happened to him. Vindication, when it came, arrived in pieces, and it arrived too late for him to know about it. In 1865, the same year Semmelweis died, Joseph Lister published his foundational work on antiseptic surgery. Lister cited Pasteur's germ theory and derived from it the same practical conclusion Semmelweis had reached 18 years earlier through clinical observation alone. Kill what's on your hands before you touch the patient. Lister's work was accepted. Lister was celebrated. The question of why requires an uncomfortable answer. Lister had germ theory behind him. He had a complete causal chain. He had the institutional weight of the British medical establishment. He was not demanding that colleagues admit to having caused deaths. He was offering a new, forward-looking practice, framed as progress rather than indictment. He was, in every structural way, positioned to succeed where Semmelweis had been positioned to fail. Semmelweis had been right first. The priority of the discovery, the logical structure of the argument, the empirical verification, the practical protocol, was his. Lister himself acknowledged a debt to the concept, though the intellectual genealogy was not always made explicit in the citations that filtered into medical education. The history of antiseptic medicine in many textbooks begins with Lister. It should begin with Vienna, 1847, and a ward where the mortality rate fell 17 percentage points in a single month. The historical reckoning has been partial and slow. By the early 20th century, Semmelweis's priority was increasingly acknowledged. A statue was erected in Budapest. His name appeared in histories of medicine, though often in a supporting role, as a precursor to Lister, as a tragic figure rather than the figure who, by any rigorous analysis of dates and evidence, made the central discovery. In 1906, the Hungarian physician and public health pioneer's name was given to Semmelweis University in Budapest. That recognition matters. It also arrived 40 years after his death in an asylum. The medical profession he had fought has never produced a formal, institutional acknowledgement of what was done to him, and, through him, to the women who died in those wards during the years his protocols went unimplemented. The number of those deaths is not precisely calculable. It runs, by any reasonable estimate, into the tens of thousands across the European and American clinics that continued operating without hand-washing requirements through the 1850s and into the 1860s. Those are not abstractions. Those are individual women, named women, who came to hospitals expecting medical care and received, instead, an infection carried on the hands of their physicians. The systemic machinery of the rejection is worth naming clearly, because it did not dissolve when germ theory arrived. The same machinery, the protection of professional status over patient welfare, the demand for theoretical completeness before acknowledging empirical results, the institutional punishment of voices that implicate the institution, operated in medicine long after Semmelweis, and it operates in fragments today. What happened to him was not a 19th century aberration. It was a 19th century case study in how institutions respond when evidence threatens the self-image of their practitioners. There is one detail that has stayed in medical historiography because it is almost impossible to let go of. In 1865, the year Semmelweis died, Joseph Lister published his antiseptic method. That same year, Pasteur's germ theory was sufficiently established that the causal mechanism Semmelweis had been denied, the missing piece his critics had weaponized against him, was available. If his colleagues had committed him 6 months later, they would have had to reckon with a man who had been demonstrably, verifiably, categorically correct for 18 years. We cannot know if that would have saved him. We can know that the timing of his removal from public life was, at minimum, convenient for the people who had dismissed him. He died not knowing that history would confirm him. He died not knowing that the basic act he mandated in Vienna, washing your hands before touching a patient, would become so fundamental to medical practice that it would be taught on the first day of nursing school, inscribed on hospital walls, the subject of global public health campaigns. He died believing, with documented reason, that the institution he served had chosen its own comfort over the lives of patients, and that no one with the power to act had chosen to believe him. He was right about all of it. The women who died in the wards of Vienna and Budapest and Philadelphia, in the years when the data was available and the protocol was known and the decision was made not to act, they were not killed by ignorance. They were killed by the refusal to be uncomfortable. That is a different kind of death. It has a different kind of cause. And the person who traced that cause, with chlorinated lime and mortality tables and the desperate arithmetic of human lives, deserves to be the name you know. His name was Ignaz Semmelweis. Remember it.